All right, so let's talk about this, because we're really behind on that. All right, so urolithiasis, right? Now we're getting to the diseases. All right, so basically kidney stones. Urolithiasis is a kidney stone anywhere in the urinary tract. If you want to specifically say a kidney stone in the kidney, then we say nephrolithiasis. Litho means stone. The actual stone is called a calculus. Sounds like math, but it's not. All right. Many calculus, we say calculi, but that's what that is. All right. It forms in these renal calyxes, or the pelvis of the kidney, not the pelvis of the bone. And if you know where the calyxes is and the renal pelvis is, go back to the first 50 slides, and you'll see the anatomy on that over there. It's usually asymptomatic until it reaches the ureter. That's where we start having these symptoms. And it can be usually composed mostly of calcium. About 3/4 of the way we're looking at calcium. But it could also be made of magnesium. We also call that struvite stone, okay? Or also people with gout will have uric acid crystals. That's about 5% of cases. The size of these, well, they'll vary, okay? You can see over here, you know, in terms of like a nickel, how big this is, or over here. Now, think of this as, now you got your ureter, right? The tube that goes from your kidney to the urinary bladder, and it's about 12 inches. And this little stone is hard, has razor-sharp edges to it. It's about the size of a tomato seed, okay? And it's going down this urethra, and as it does, it's cutting through the urethra's wall, and it's going. That is damn painful, all right? I never had it, all right? But I did ask women who had kidney stones, not men, kidney stones, and went through labor for childbirth, which one was worse? 4 to 5 of them say kidney stones is 20 times worse than giving birth, all right? So just giving you a heads up, this is very painful, all right? If they're in the kidney, this is a pretty big one, okay? So you can see it's in the kidney over here. This is a pretty big one. We call this a staghorn stone, or a staghorn stone, because it's like a deer staghorns. It looks big like that, okay? All right? But if there's just one over here, then chances are all these will be able to make urine and you won't have any problems. So if it's in the kidney, most often you don't get any symptoms. It's when it goes into the ureter that you're going to have problems, or you're going to have some pain. So it's a genetic predisposition of this. Like, for instance, people have gout because of uric acid. Mostly men have this than females. Usually asymptomatic. You may pass this, if the stone is so small, you may pass it, it goes through the ureter, and you don't even feel it, okay? But usually they would have hematuria, because as it goes down the ureter, it's cutting through the walls, and it's causing pain. So you get this loin to groin pain where it starts here and it radiates down into your groin, all right? Flank pain, nausea and vomiting because the pain is so severe. Complications. If the stone is in the ureter, then prior to the ureter, the urine is going to go down, but it can't go past the stone. So therefore, you're going to have this ureter that's going to start getting bigger and bigger, right? It's going to start dilating because it can't go past there. Does that make sense? Right? I'll show you a picture of that. That's what we call hydronephrosis. Pretty bad, okay? But it can also cause urinary tract infections because, as I said before, urine is a great medium for bacteria to grow in. So if there's a lot of urine there, and if bacteria can get up there, it will start colonizing in that urine over there. So we have a lot of urinary tract infections. So you have this typical loin to groin kind of pain, very typical. Okay? Hydronephrosis is just what I said, where it starts, the kidney gets enlarged because you have this stone over there. And all this fluid starts building up, and the whole kidney gets ballooned out. Okay? When it does, just similar to the polycystic kidney disease, the pelvis of the inner portion of the kidney starts getting bigger and bigger and starts pressing against the nephrons and obliterating all of them. okay? And that's what happens with that. So you have a stone over here, so therefore there's nothing going on past that, right, after that. But before that, the urine has no place to go, so it starts building up and building up. And here's the pelvis over here. It starts getting enlarged. If it's far down over here, then this whole thing gets enlarged. Bacteria can climb up here and say, wow, look at all this urine over here, and starts colonizing. Okay? That's what happens. What does it look like? Is that. All right? Pretty graphic. All right? You have a stone that's over here, and you have this whole ballooning going out. If we make an incision right through here, you can see how this hydronephrosis takes over, and if the area around here is all the nephrons, then these, just the way we have the polycystic kidney disease, it starts getting bigger and bigger and starts pressing against those nephrons and obliterating them so that it turns into renal failure. Okay? And that's what we don't want. Okay? So treatment is that we got to pass this kidney stone. So give them a lot of liquids. IV fluid, just pour them, get all that. So we got to get that water down to try and push that kidney stone into the urinary bladder so you hopefully you can get it out. And you give them painkillers, right? Any kind of analgesia. If the stone is so big, then we might have to do something called lithotripsy, which is basically using ultrasonic sound waves, boom, and it's going to break that up. All right? So you have this ultrasound that's going to break up that stone if it's big. And they'll break it up, and hopefully those pieces will then go down into the urinary bladder. So that's what goes on with that. Okay, questions on that? All right, so let's talk about infections of the urinary system. All right, urinary tract infection. Anywhere, it's a general term where you have an infection anywhere in the urinary tract. Okay? If it's in the kidney, then we call it pyelonephritis. If it's in the bladder, we call it cystitis. In urethra, then we call it urethritis. In urethritis, the only one I want you to understand is most common cause is chlamydia. Gonorrhea can cause the same thing too. It's a sexually transmitted disease. Okay? So important to treat it before infection goes upstream. You don't want, if it's in the bladder, you don't want to go upstream into the kidney because then it's going to affect the kidney function. Most common cause is E. coli. Definitely, E. coli is the #1 cause of urinary tract infections, with protease and Klebsiella as running second and third in there. Okay? Risk factors, more females than males, and it's simply because the urethra is very short in a woman. In a male, because you got the penile urethra, it's usually about 5 or 6 inches longer. Okay? So if the bacteria that's on the penis needs to go into the bladder, it has to go up the urethra. It takes about 8 hours to go from the tip of the penis into the urinary bladder. By that time, the man is going to pee. And when he pees, he's going to wash out that bacteria, like the itsy bitsy spider kind of thing, right? Okay? But in a girl, okay, in a woman, that there's only 1 to 2 inches there. And the vagina is a very, I don't want to say dirty organ, but there's a lot of bacteria in there. It's very easy for the bacteria to go from there, or even by the rectum, it can go from the rectum and go up the urethra. So they end up getting a lot more UTIs than men. In men, they get more UTIs if they get catheterized, all right, as you get older, as men get older, or in a large prostate. We'll talk about that, but basically as the urethra goes through the prostate, if the prostate's enlarged, you can squeeze against the urethra that it's surrounding, and now the fluid or the urine sits in the urinary bladder for a longer amount of time, and that's what happens there. Pregnant women tend to get a little bit more of this because there's a lot of progesterone on board. When there's a lot of progesterone, progesterone is going to relax smooth muscles. And there's smooth muscles around the ureters. So therefore, there's less milking of the urine to go into the urinary bladder. So we'll end up having a lot of stagnant urine that's sitting in the ureters, which, again, bacteria love to go and party in urine. Okay? So these are just places that you would actually see the infections occur. So let's talk about pyelonephritis. Pyelonephritis is inflammation of the renal pelvis, right? The inner portion of the kidneys, okay? Now, the most common cause is that we're going to have from the urinary bladder, it's going to move up the ureters, and then it goes into the kidneys. We call this vesico-ureteral reflux. It's retrograde, okay? It can go from the bloodstream into the kidneys, but that's rarer, and that's more because of sepsis, right? If you have bacteria in the bloodstream, you got other bigger problems to worry about. But that's what happens with that, and it can lead to, as you know, renal failure. Symptoms that usually have fever, they usually have the flank pain going on, and CVA tenderness. CVA stands for coastal vertebral angle. Coastal meaning ribs, vertebral meaning vertebral column. So it's basically the angle between your rib cage and the vertebral column. There's that angle over there. And what we do is that's where your kidney lies in, that angle. The angle is actually shown. If you watch if you look through the first 50 slides, there's an explanation of it in there. But what we do is that we just tap it, and I'm not saying punch, all right? You tap over there, that person is going to jump if they have pyelonephritis, because you're tapping right over the kidney, and you're just tapping. That person will jump. I mean, you tell her, I'm going to just tap you here. Don't just surprise them, all right? But you just tap there. It's kind of like the head of a pimple, has that little pinpoint that like, kind of thing, all right? And so we usually say that there's CVA tenderness. You just tap on that, and they will jump. You could use that too, so you got to see it in context. So yeah, she said that CVA is cerebral vascular accident, but when we're talking about, there is no CVA tenderness, then we're not, then it's using the other CVA. Does that make sense? It's all in context. You just have to read between the lines of what they're talking about. Between the ribs and the vertebral, there's an angle there, right? So it's like the ribs are here, and then the vertebral column's here. So that angle that's right there. Does that make sense? Yeah?
I thought when you were testing it, though, I thought you didn't want to do it downstairs. I thought you were supposed to do like, stick your hand in and
No, we just do it. Yeah. I don't know if it was actually taught us like that. I know percussion is different, but this was, no, we just a little tap. Yeah. I guess for you guys, yeah, I guess do that, but we just do a little tap on there. That's how it was taught to us. But as long as you do that, you know what I'm saying, a little tap over there, you could just like touch over there, like little tap. Believe me, all you'd have to do is a small tap. You don't have to tap it hard at all. They really have pyelonephritis, they will jump. All right, it's clear as day that they have that. Okay? So this is just showing you here's pyelonephritis, what happened here. It can happen from reflux, so from the urinary bladder going up this way, or it could come from the bloodstream and going into there. This is more common than the other way. Okay. Then we have cystitis. So this is inflammation or infection of the urinary bladder, and in this case, the etiology is mostly because of the things we mentioned in terms of, let's say, a short urethra for females, or if you're going to catheterize a male or female for that matter too, because you're introducing more bacteria that way. I know everything's supposed to be sterile, but it's not 100%, okay? So that's where that can happen. And this could lead to pyelonephritis if it's not treated, right? It could go up the ureters and go and start landing and colonizing in the kidney itself. So again, you got frequency, lower abdominal pain, also dysuria, fevers, malaise. Sometimes the bacteria can start eating away at the wall of the urinary bladder. If this happens, blood can also be in your urine. So in that case, we refer to it as hemorrhagic cystitis, if there's going to be hematuria there. Okay?